Refer to the chart and write appropriate information on the laminated appointment info sheet on the outside of the exam room door. Once done, walk into the exam room and greet patient and client and introduce yourself.
Hello, how are you?
Fine.
Good. How's George doing?
Fine.
Good.
Make friends with the patient by offering treats, petting, baby talking, while asking the client questions about their cat.
Are you in there?
This step can be somewhat challenging for cats, so don't push them or else their anxiety will just escalate.
How are you? Hi. Oh, good kitty. How's he doing?
Fine.
Good. Is George indoor or outdoor?
Indoor, outdoor.
Okay. Is he eating and drinking okay?
Mm-hmm.
Oh, hi. What kind of food do you feed him?
Science diet.
Do you measure his food?
I just leave food in the bowl.
Okay. Any recent vomiting or diarrhea?
No.
Good. As far as his dental health, are you able to brush his teeth or does he like dental treats?
I don't brush. No.
Okay. It's difficult with kitties. Any lumps or bumps that you've noticed on him?
No.
Is he on any medications?
Yes, thyroid medication.
Okay. Still getting the 5 milligrams twice a day?
Yes.
Do you need any refills while you're here?
Yes, please.
Okay. I can get that for you. Well, aren't you sweet? Such a good boy. Are there any other problems or concerns with George?
No.
Okay. Do you have pet insurance for him?
No.
Okay, well, I'll tell you about the pet insurance that we prefer. Is called Trupanion. After his exam today, he will qualify as getting a free 30-day trial of Trupanion. I'll give you a brochure about it too, so you can take it home. It's nice because they are able to budget to whatever you need for your plan.
Refer to George's reminders on his chart. Tell the client what George is due for.
Okay, it looks like he is due for his rabies vaccine. His feline distemper vaccine isn't due until 2015. As far as the feline leukemia goes, I see that he's been tested last year and he was negative. Have you thought about doing the vaccine for that?
Yes, that'd be fine.
Okay, so he will need a booster of feline leukemia in 3 to 4 weeks, and they can set that up at the front desk when you leave.
Okay.
He's also due to have a stool sample checked. Did you bring a sample by chance?
Yes, I have it right here.
Excellent, thank you.
Let the client know which doctor they will be seeing by writing it on the whiteboard on the back of the door. After that, excuse yourself from the room and let them know the doctor will be in soon.
All right, I will let Dr. Sherry know that you are here. My name's Becky if you need anything, and I'll be right back.
Create an estimate, including the vaccines you discussed, testing, and medication refills. Place this estimate with the chart for the doctor to have. After this, let the doctor know that the patient is ready while you draw up vaccines and get all needed supplies.
Sherry, I've got George in room 1.
Okay. Sorry, I had to do that.
Once you go back in the exam room, pay all of your attention to George and place him on the table as soon as possible without being forceful.
It's not that one. You want to make sure we have the right estimate. Is it tucked under? Okay. George, kitty kitty. How are you? Hi, Happy Chat. Oh, such a good boy. Let's see. George's weight is about the same. That's excellent. Good. Hi, buddy. How you doing? You're purring. He looks great. He has a good appetite then.
Yep,
Good,
definitely.
good. Doing fine. He's purring up a storm. It's gonna be hard for me to hear. Yes. He's got a little tartar buildup on his teeth. At this point, are you doing anything as far as brushing or any dental
No,
chews or
I
anything
don't.
like that? Okay, okay. Brushing cat's teeth can be daunting, a little bit daunting, but it's one of the most important things you can do. So I'll give you a couple of suggestions. The treats, there's a lot of treats that they make for teeth, and the best one that I found are the greenie treats, or the Science Diet makes a food called TD that's really good for their teeth.
Okay.
And the way it works is it instead of crumbling when they chew on it, it actually squeegees their teeth. So it decreases the tartar plaque by 30%.
He likes your treats,
So,
sir.
and that's exactly that's the
Okay.
TD, that's what we use for treats because they like it so much. You just have to make sure you don't eat too much and get heavy, huh? Good boy. Oh, he's doing good. He stopped purring at just the right time. What a good boy he's being. Look how good he is. He's relaxed and not minding me doing all these things for him. Now let's peek under your tail. Good boy. All right. So a little bit of tartar on his teeth. It's not to the point where he needs them cleaned,
Okay.
but if we don't do something in the future, you might need to have them cleaned. And
Okay.
so typically that's something where they come and stay for the day and it does involve anesthesia, so we like to be a little proactive and try to do things with that. Now, what a lot of times I'll do with the kitties, or sometimes even the small dogs, is just use a little bit of gauze, put it on my finger and just lift the lip and rub the teeth. See how good he's being for that? And everything you find on there, that's that tartar and plaque. Well, that's the plaque, sorry, the tartar doesn't come off, but the plaque does.
Okay.
So that would be something that maybe you could think about trying now.
Okay.
If we're going to be doing anything for the teeth as far as home care, it needs to be done a minimum 4 times a week.
Okay.
So whatever we decide to do, and it can be a combination, brushing one day, dental chews another day. So. Okay, good. He looks terrific. I'm very pleased that his weight isn't changing, so that's very good. Okay, and he's due for the rabies and the leukemia vaccine today, and so if we do everything today, this would be our total.
Okay.
So that'd be all right. All righty, mister, guess what? We're going to bother you just a little bit.
You'll be a good boy, won't you?
That's right. Now, first I need this side. Good boy, good boy. Kitty, 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 kitty. Excellent. One down, one to go. Turn this way. Turn this side. Good boy. Very good. Kitty, 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 kitty. Excellent. Boy, you act like you didn't even feel him. Good boy. Right. He was very good.
Once vaccines are done, take the white basket and all syringes as you exit the room.
And let's talk a little bit about heartworm. Because heartworm disease is very problematic in cats if they are exposed to it. Is he indoors all the time? Indoor, outdoor?
The doctor will finish discussing a plan for George with the owner while you do billing, fill medications, get pink slips filled out for any future visits, and activate the True Payment form.
the Revolution.
Okay.
So I get the prescription started there.
All right.
Yeah.
I can get that ready.
Alrighty, thank you.
Are you ready to go? Here's the refill of his thyroid medication. It's the same dose that you've had before, 1 tablet twice a day.
Okay.
And if you need more, give us a call and just let us know.
Okay.
Here is his heartworm medication that she was talking to you about.
Okay.
That is a topical medication, so there are directions in there about how to apply it, but what you need to do is you need to push down on the vial to puncture it, and then you apply the entire amount in between his shoulder blades.
Okay.
And that's on the same day every month.
Okay.
Here's the Trupanion information. He now has pet insurance for the next 30 days.
Okay.
And this brochure kind of goes over their coverage, and after the 30 days you can make a decision as if you want to continue it.
Okay.
So here's that for you. All right, kitty cat. You were very good today. It's time to go. Oh, you got that treat. What you doing there?
Escort the client and patient to the front desk. Give the pink slip to a CSR and let them know George is ready to be checked out. Reassure the owner that George did a great job today, and one final farewell.
Make sure it's